There seems to be a common misconception that for people who lift weights and routinely load their spine, that you need to do an equal amount of distraction or lumbar traction in order to maintain a healthy spine. Today I want to talk more about that. What's up, everybody? My name's Dr. Michael Mash. Welcome to this week's episode of Whiteboard Wednesday. So I've worked with a couple people in the last few weeks where they had this issue where their back feels fine when they deadlift, but they tell me when I go to hang from a pull-up bar, it feels like my low back wants to rip apart and it just hurts really, really bad. What should I do? So at the risk of just saying, well, don't do that, I wanted to give you more of an explanation. So there's this idea that with all of the compressive loads that happen with the spine, with different lower body exercises like the squat, deadlift, and lunges, that you need to do some sort of opposite pulling or either distraction, whether it's hanging from a pull-up bar or actually getting into like a mechanical lumbar traction machine, which works to try and separate those bones. This idea that you need to do that to counteract the amount of compressive forces that you put on it while you lift. And there's no evidence to suggest this. Here's the thing. When you sleep, your spine naturally decompresses because you're lying down and you don't have gravity working on you. So your spine naturally decompresses as you sleep. And during the day, life in of itself is compression. So instead of trying to counteract life with decompressing and hanging from a pull-up bar or hanging upside down or having a machine try and pull you apart, the idea is to get more adapted to compression because that's what you're doing in life. You need to adapt. It's a specific adaptation to impose demands. Life imposes compressive forces on you, so you should get better at being in compressed positions. Build up your load tolerance. It's this idea that, well, what happens when I try and hang from a pull-up bar and my low back hurts really, really bad? Here's the thing. When I do that, again, this is N of one, this is just me. When I try and hang from a pull-up bar, my back hurts a lot too. So I just don't do that. And I live a pain-free low back lifestyle where my back doesn't bother me at all because there's nothing in life that I need to do that involves me hanging from a pull-up bar. Now, if your goal is specifically to be able to hang from a pull-up bar where your back needs to tolerate decompression or tolerate traction forces, then you might need to use some graded exposure in order to slowly get it to adapt to that. So you might need to start working on hanging from a pull-up bar so that your low back can adapt to that. But just erroneously hanging from a pull-up bar because you think you need to, because you think that the back needs to be aggressively decompressed in order to be safe and healthy, there's no evidence behind this. So for those two people and for myself, what I told them was, hey, look, just because your back hurts when you hang from a pull-up bar doesn't mean there's anything damaged with it. This is not something you need to do in order to have a healthy spine. Just don't do that. Continue to deadlift, continue to squat. If everything feels good and literally the only thing that's bothering you is hanging from a pull-up bar, then maybe you just don't need to do that. I think we need to, in the grand sense of schemes, anybody can go through any kind of movement that can provoke pain. What you really need to think about is, okay, this movement hurts. Is this a movement that I need to routinely do in my everyday life? No? Okay, then no big deal. Or is this necessarily going to contribute to injury down the road? It's hard to say. So that's the big picture. You don't need to hang from a pull-up bar to outdo the compressive forces of deadlifts and squats. And just because something hurts, if you don't need to do it during your everyday life, then just don't do it. That's the deal. If you enjoyed this, please subscribe to our channel. Again, I'm Dr. Michael Mash. Thanks for watching this Whiteboard Wednesday.